All right, thanks everybody. You should be able to see my screen, which has our AJE slide and the topic of the day. Oops, if I don't kind of push it through. If you are having, we're going to go over here to the information. If you are having any problems logging on or calling in, if you're logging on and you can't hear us, you can always just call in, and the call-in number is at the top of the screen right here, logistics-wise. Also, I have muted everybody but our speakers because we are recording, and so we try to keep the amount of coughing and paper turning and Metrobus noises to the minimum. But to officially welcome everybody, excuse me, this is Special Education Thursday for June 29th. My name is Molly Whalen, and I'm a longtime special education advocate in the District of Columbia. And for many of you who have listened in, you also know that I am a parent of two now teenagers with autism who both were born in the district and also have gone through all the special education services and early identification in the district. So we create Special Education Thursdays for parents. We have lots of other professionals listening in, but the idea is to give parents a little bite-sized piece of a different corner of special education. So we take a different topic that may seem a little complicated, and instead of getting into the law or policies or different pieces like that, we take a topic and try to explain it in the way that a parent might appreciate or might understand. And we've really been enjoying talking to lots of different experts and practitioners in the city. And, we do this on behalf of Advocates for Justice in Education, which is the Parent Training and Information Center for the District of Columbia. So if you ever have any questions about anything we talk about or any avenue of special education, we always encourage you to give AJE a call. I'm really excited to have two experts here with us today, Dr. Sharron Williams, who's a psychologist, and Andrea Handscomb, who's a speech-language pathologist, a speech therapist, and they both come from early stages. And the topic we're going to talk today can be really confusing to parents and probably some, school folks as well. And it's the difference between a medical versus an education autism diagnosis. So before we get into that topic, I want to welcome our two guests and ask them both to just kind of introduce themselves and share how they got into this field and what kind of work they do in the district. So Dr. Williams, Sharron, if I can start with you.
Yes, hi. Thank you, Molly, so much. Andrea and I are just happy and elated to be a part of this process with you. We love to provide information to parents. We also feel that parents are the first advocates for their children, and so the more they know about their child and or a condition, the better they can advocate for their child. And so, as Molly stated, my name is Dr. Sharron Williams. I am a psychologist with DC Public Schools. I have a doctorate in clinical psychology. I have been working in this field for probably about 10 years now, and I have done probably close to 1,000 assessments over these 10 years, specifically working with DCPS public schools as well as the charter schools in the area.
Okay, and hello, my name is Andrea Handscomb. I am a speech-language pathologist. I've been practicing for about 16 years now, and actually I originally came down to DC to go to GW, where I had an internship with Georgetown as they were first forming their autism clinic. So that was a really great experience for me, and so I'm really happy to be wrapping back around to those roots and discussing autism. For a lot of my career, I've worked with deaf and hard of hearing children, both at the River School, which is a private school in Washington, D.C., as well as Gallaudet University. And of course, I've been at early stages for about 4 years, so back to doing diagnostics, which I also really love. But always my passion has been with the little kids, so I'm very happy to be here today.
And thanks so much to both of you. Before we get into, because we have limited time for each session, we're going to really just focus on this issue around the different types of autism diagnosis. If people have questions about autism, early stages, anything else we're kind of referred to. We've actually already done some Special Education Thursday webinars on those topics, and you can find those on the AJE website archived. So if you may think, oh gosh, they didn't really talk, in depth about what early stages is or early identification, it's because we've already had some sessions on that. So, and I will also at the end kind of refer you to where that link is if you're interested. So let's go ahead and get into it. For a lot of parents, I don't think they even realize there is a difference between a medical versus an education autism diagnosis. So can you both, or one of you, kind of explain kind of the basics around the difference and what it means and why there's a difference in those two?
Yes. And so the difference primarily is that when we have a diagnosis of autism, we can have that medical diagnosis from your pediatrician or physician. Where the school comes in is a classification or identification. And so we're using that to guide how we want to plan or create a plan for a scholar who is showing some of the same characteristics as a child with autism. And so we have a table that was provided to you, and it lists many of things in terms of the differences. But what I want to highlight is the distinction between the educational and medical diagnosis or decision is that it really comes down to the impairment. And so when we have a medical diagnosis, that pediatrician or physician or outside clinical psychologist is looking at the impairment on our activities of daily living. And so that can include self-care, our social interactions with our peers and with our family members. And we're looking at those same things in the school side, but what we really have to determine is the distinction of the impairment on educational performance. And so that significant difference or impairment needs to impact the scholar's ability to access that general ed curriculum. And that could mean a variety of things. And so it could mean that they have difficulties accessing the instruction, as well as being able to participate in their learning as well. And so that is probably the primary distinction, I believe, that kind of differentiates the medical from the educational classification and diagnosis. But we also have some other viewpoints that we want to talk about as well. And so I'm going to turn it over to Ms. Andrea Handscomb. She's going to talk about some of those differences.
Just pause for just a second, because again, we want to kind of make this, again, I'm speaking kind of in the role of parent and asking. So we could just stop for a second and let me ask about, is there, when we talk about education and accessing education, and I know you all deal with the little ones, so can you give us a couple of examples of what that might look like if a child with autism or looks like autism, how would that look like in the classroom, and what would be the impairment that you're talking about accessing curriculum? Let's put it down into some really tangible things. What does that look like?
Okay, so this is Andrea, and I can certainly speak from a speech-language pathologist point of view in regards to communication. And I think one thing to really emphasize is that it has to have an educational impact, which includes academic, but is not solely academic. And I think sometimes that can get lost. But of course, and Molly, you'll appreciate this as a parent, the social aspects of school are also extremely important. So it's not sufficient that your child is simply meeting the benchmarks of the curriculum that the school has set up in terms of early literacy skills, so things like participating in circle time or being able to respond to the teacher's questions. But it's also really important that the child is able to both verbally and non-verbally interact appropriately with the people in his or her environment. So that would include both the teachers and the children. And so and that is really in, at least I can speak for DC Public Schools, in our goal curriculum standards. There are lots of different social benchmarks. That's actually a really critical skill that they're looking at in young children because it's a foundation for all other academic skills.
So could it be fair to say something like it's not just that whether they know their numbers, and we know a lot of kids with autism may be able to be really good at decoding words and letters and have their ABCs spelled, but that when a classmate talks to them or tries to play, do imaginary play or something with them, they completely are, I don't want to say shut down, but shut off from that. So is that a good example that a parent might be able to see? Because sometimes parents think, oh no, my child's doing really well. They can do the ABCs and they know their colors, but they may be not seeing any social interaction with any other students.
Yeah, I think that would be fair to say. And we definitely see that a lot here in our work, that oftentimes the child will come in and they will have high rote memory skills. And so, yes, they can identify their letters and their shapes and numbers, and sometimes even read higher level sight words. But what is missing is that kind of intuitive social interaction with people and that knowledge of social conventions. And so what we find is that it does impact their ability to be successful in the classroom, because yes, they can access the academic part of the curriculum, but that social emotional development, which is part of the curriculum, they're not accessing. So being able to take turns with their peers and share in interaction or engagement, let's say in a play center with another peer. What you sometimes will see is that kids who are have some characteristics of autism or autism, they may be able to engage in one-sided play with a peer, but they're directing that play. And so the minute that there's that other peer tries to assert their own ideas, their own imagination, their own language, or their own play act into the play, that's where we see some of those difficulties. And so,
shut it off or break it down, and there's no back and forth, in other words.
It's no back and forth, absolutely right. There's no social reciprocity in that. And the other piece is that sometimes you don't see that joint attention, but you can see it when it's something that is of interest to the child, right? And so if the child is interested in reading a book because they love to look at letters and they love to, label pictures or even read words, sometimes you can get that limited joint attention because it's something they're interested in. However, if another person, an adult or another child, wants to then do something different with the child in that book, we see that there's a breakdown in allowing or being able to share in that moment with another person.
Okay. So let's jump ahead. So we're seeing this. Okay, that's going on. What does this mean in the school environment? Let's say a student does not have a medical diagnosis of autism. What would happen? Let's say they're referred to early stages and you're seeing all of these pieces. Can you give us a sense of what a parent might expect?
Yeah, so definitely that's a responsibility of the school district to determine an educational classification for that child, regardless of if they do or do not have that medical diagnosis. And so what we would do with our the children coming in would be to do an assessment. And so when I say an assessment, that does not mean a test. It means a robust grouping of different formal and informal measurements. So that would include things like a very thorough case history, because even though we're not in a medical setting, we still do need to look at all the development prenatally, natally, afterwards to see, are there any medical conditions that could be impacting this child. We would also talk to the parent and get the parent's feedback in regards to the child's strength and growth areas. We would do informal observations, because that often really, at least for me, I feel like that I get a lot of information from being able to interact with the child informally, play with that child, talk with the child, and then, of course, we would do standardized measurements as well.
Okay, and so again, we always like to kind of break it down for parents. When you say informal, that would just mean like you would go into the classroom maybe and try to play with the child or observe play, right? Is that what you mean?
So it could be either within the clinic center, we would play with the child here, or it could be a classroom observation. Usually it's not so much playing with the child in the classroom because if we're going to the classroom, we want to see the child in their natural environment, and inserting myself into the classroom would sort of be foreign. But that can also, definitely a classroom observation can be a great tool, as well as teacher questionnaires.
Okay. Okay. And what's talk to us about can a child have a educational autism diagnosis and not a medical autism diagnosis?
They certainly can, because again, we're looking at what is needed in terms of support for the child to be successful in that classroom setting. And so in addition to accessing that curriculum, but also socio-emotionally developing those skills as well. And so we're solely looking at how can we best support this child in the classroom. That can require minimum support to a high level of support, meaning that they need a whole different program or class setting so that they can be successful. Whereas in with the medical diagnosis, again, they're looking at that impairment in daily function, right, and daily living skills. And they know that that includes their ability to function or participate in school as well. But what they're looking at is the whole person. And so they want to make sure that they have that medical diagnosis to give parents other options, that they can tap into resources within the community. And that could be the federal or state resources that are available, or even resources available through insurance, such as getting ABA therapy.
Gotcha. Okay. And I put your true-false question up, so I guess it's a good time to also ask, could a student or child have a medical autism diagnosis and not be, not have an IEP or be classified as an educational autism diagnosis?
Yes, and so the answer to that is yes, it is possible. I would say for us, especially with these very young children that we are seeing, it's not common for a child to come in to have an autism diagnosis who would not be found eligible under some sort of IDEA classification, but it is possible if a child has, let's say, very good verbal skills. They're currently in school. Both the parent and the teacher are reporting that the child's doing well with transitions, that the child is meeting the benchmarks for the curriculum goals and social emotional, has friends, is well adjusted. That is something that is possible. And I know that it would be really a separate talk. I'm sure you guys have probably already covered it, but often for a child like that, they may just need some accommodations in the classroom through what we call a 504 plan versus modifications, which would be changes really to the curriculum. So, generally it's possible, but usually that child continues to need some sort of support.
And thanks for that plug, because we actually do have a recorded webinar on the difference between a 504 plan and an IEP. So I encourage people to go there. And so I think that, like you said, it's, this is always a great time for, one of the things we like to do is really emphasize the things that really do help these students. And one of them is early intervention. And I know you all are passionate. If at early stages you believe in this, but we could have a student who has autism who's gotten a lot of good early intervention, and by a certain point in their educational career, they don't need an IEP because they've had maybe a lot of good of ABA and a lot of good strategy building, and they're doing well academically. So it's a great to say early intervention is the key, especially for students with disabilities, especially with autism, and that's what early stages do. So I think it's really great to let parents know there's a lot of good hope out there if they focus on early intervention.
Absolutely. Early intervention is key, right? Research shows that if we can get a child in early and address those needs early on, you kind of, I think of it almost as front-loading the kid with all of the supports they need so that they can develop those compensatory strategies and skills to be more successful down the road without needing that substantial level of support. And we do see that, right? We see that there are high school kids who are being really successful in the classroom, that they have peers, they have their friends, they're able to interact with them because they have developed some of these kind of rote skills. But what we do also still find is that sometimes those kids struggle more with anxiety or somewhat social anxiety because they're really kind of obsessing about the next steps or what I need to do to have this interaction. And so even that kid may require some minimum supports in schools, right? Like being able to just sit with a therapist once a week or something like that to role play social situations. And so we, I'm sorry, go ahead.
Yeah, I just really want to, because I think that's a fantastic point. Also clarifies that when we're talking about autism and both of these kinds of diagnoses, that the supports a child may need is very fluid throughout their life. It could be more intensive they might need, or less intensive, where they've gone from an IEP with lots of supports for autism support, but then later need just a little bit of counseling or just a time with the social worker, or even a speech therapy. So, and I've got your slide up that talks about, I think we've covered some of it, but I wanted to make sure before we run out of time, if there's anything specific that you want to talk about on the, significant impairment and the requirements piece.
Well, just to piggyback on what you were just saying about that continuum of care, I think one thing that's really changed over the course of both Dr. Williams' career and my career is a bigger emphasis that the school programs have on response to intervention. And so I think that that's a really powerful tool for parents to keep in their back pocket, because I know that there's kind of a struggle between wanting to have your child meet all of the academic and social goals, but then also that fear of losing supports. And so knowing that there is always response to intervention, if your child no longer is eligible for services and if you're feeling good about where your child is performing, that there is always that whole tiered system to provide some support. And you can still go back through the eligibility process while receiving those services, but you don't have to wait completely for the eligibility process to go through before those interventions can be put into place. So it's supposed to be somewhat of a, let's try to give a child a little bit of support, see how he does, and then if not, you kind of keep going to the next steps up to the eligibility. And Molly, you might have even covered response to intervention on another webinar.
We have not, but that is, one of the fun parts of doing this, and we've done them since January, is we keep adding topics. And so I think we'll do the I one coming up. But I think it really emphasizes also to parents, if you're seeing this and listening, that one of the basic things of special education and support, IDA and supporting students with disabilities, is that when we see a concern, we should have an intervention. Sometimes it could be something that a teacher just does as far as strategies and see what works. And so that at the core of this is intervening so that a student can get what they need to, as we've said a couple of times, access that general ed curriculum, be able to it.
Mm-hmm. And I think, Molly, most importantly, participate in their own learning. And so I want to highlight that with parents as well, because we can see children who are really high functioning. They can access that curriculum, but how much are they, or how well are they participating in their learning holistically? Right? Yeah. So we don't want them just to go through school, just learning those educational components, because we know that social-emotional piece is such a big part of our holistic learning. And so we want them to be able to enjoy school, right? We want them to feel good about school and their role in their classroom as being the scholar. And so I think that's going to be very important. And here at early stages, we really kind of play on that social-emotional piece. So we're so big with even getting down on the floor and playing with kids, with the parents, and kind of modeling that play, that floor time play with them, right? So they can know what to expect And so they can be looking out for these things as well in their children in a classroom. Some parents report that, yeah, my child does play with other kids. But when you do the observation, you see that it's more one-sided or it's more parallel play, and they're not really engaging. And so that can also cause that child to feel a little anxious, right? So because they kind of feel left out. So we want to really look at the child holistically and making sure that they feel good about their learning.
Right, and I think that's the piece in parents who are listening too is, they don't always, they see maybe a child playing or building blocks and they're sitting next to another, student kind of thing, but being able to see what that difference looks like between parallel play where they're sitting next to each other and building a tower versus connecting with each other where here, I'm going to give you one block and you're going to give me another and we're going to build a bridge or something.
Yeah.
So put it down into those terms for parents. And I want to circle back to our topic. I know this is a hard topic to stay, focused on, and it's partially my fault too. But talk to me about if a parent goes through and gets an educational diagnosis of autism and has an IEP, but has never seen a developmental pediatrician or a pediatrician to get a medical autism diagnosis. I'd love to hear both of your thoughts on, should they do that? Do they have to do that? Can they just get by with an educational diagnosis?
I think it's very important that they follow up with their doctor. And so we often recommend and highly recommend to parents. And we explain the process that this is an educational classification or identification so that we can meet your child's needs. But I highly recommend that you speak with your pediatrician or physician because, again, as I stated earlier, we want to make sure that that child is being able to get services that they need in school and outside of school. So at home, those things need to be in place as well. And it really helps the child be able to transfer or generalize those skills when it's being done in both environments. And so it's really, really important that they get that diagnosis so that they can access those additional resources.
Yeah, and I know that definitely with children who qualify under autism or other developmental disability categories as well, I often will highly encourage the parent to go see a developmental pediatrician and to make that appointment. I usually will say run home and make that appointment today because it can often take about 6 months. Of course, not saying the doctor that wouldn't prevent you from getting an IEP, wouldn't affect your services or anything like that. But I can tell you from when I was at Georgetown that there's really a lot of other medical disorders that either accompany autism or that look like autism but that aren't autism. And so without being able to run those medical tests, there's limited information. So, for example, seizure disorders are very common in children who have autism. And so, clearly we can't run a, overnight EEG on the child. Other dietary differences. The doctors often will do metabolic screenings. Will collect samples of urine and blood and things like that. And they're also
sleep disorders.
Sleep disorders. And, that can just have huge ramifications on any child, any person, not getting a good quality night's sleep. And so there's so many things that the medical community both can look at in terms of diagnosis, but also in terms of physically helping the child be in the best health that that child can be in, which of course makes you much more available to learning. And sometimes it's just simple things like a child with a sleep disorder, the doctor may recommend melatonin, which is, very natural, and getting a better quality night's sleep can have huge, excellent positive effects for the child in school in terms of behavior and attentiveness.
And we know that a lot of chromosomal disorders, genetically, there are disorders that often manifest or have characteristics of autism, but as Andrea said, may not be solely autism because of all these other medical conditions. But for us in the school, it doesn't negate what we're treating or what we're planning for, right? Because we have to address the areas of impact that show delays or deficits.
Right.
And it's really important outside of school.
Right. And I want to make sure, because I told you we'd run out of time on this one, but absolutely, it's probably one of those disabilities of all the disabilities that really does need hand-in-hand with their medical team and their school team, and sometimes those are going parallel courses but should be connected. And I think we always keep these webinars or the Special Ed Thursdays kind of tied to DC because we're talking about DC. And it's a really good point to note that it can be a long wait list to get in to see a developmental pediatrician. And so it's really important for parents to follow up on that, even though it may mean a couple months wait and, have that connection. Before I lose time, I flipped to the resources and next steps. You guys have given us a lot. So I'd love to maybe for you all to highlight the big ones that if a parent's really worried, they're listening and they've got, well, I've got an autism diagnosis, or we're going through the process, and I want to learn a little bit more or see what I should think. Where would you guys on the resources suggest to start, or where's a good place for them to connect?
So just in terms of overall autism resources, it's for younger child especially, we really like the Autism 100-Day Toolkit, which I think is on Autism Speaks, right? Yeah. That's excellent. It really breaks it down. Also, every year they have an autism, I don't know what it's called. It's not just the walk. I think it's like a fair. It's a fair. It's on the mall. Yeah. And they give away free 100-day toolkits. I think it's usually in the fall. But you can also download it online, or you can order one for free as well. But that's a really great resource.
Yeah. And they also have a lot of other resources on that website about groups, parent groups, things that they're doing in the community. So it's really a great resource for parents.
Right. And then, of course, we definitely want to plug both of you are with early stages, and we have done some webinars on early stages, but everybody who's listening has questions. It's a great place to start, definitely with the little ones, to go and see it. And what we always like to say when we're talking about early intervention and early stages for parents, if in doubt, make that call, send that email, reach out. There is no harm in finding out that everything's okay, but there's great benefit in finding out maybe there's some delays or some concerns. So we really want anyone listening, if they have a concern for a child that's in their lives, to definitely reach out to early stages, and you might be connected with Dr. Williams and
right.
on the next time in a more intimate setting. So terrific. We're just a few minutes past 1 o'clock. I really want to thank both of our guests. And we do have another Special Ed Thursday starting in 2 weeks. And of course, I pulled the schedule off, so I can't remember what's our next topic, but you can always find it on the AJE website under webinars, and you can see what's coming up. We hold the Special Ed Thursdays every other Thursday, that you can listen live, but you can also do the recording. So thanks so much, and I think we definitely will do a topic on RTI, and we might even have to read autism. Thank you both.
Thank you so much.
Thanks so much. Bye-bye.
Bye-bye.